Millions of Americans haven't even gotten their first dose yet.
And a good chunk of the population, we should note, is not even eligible. Of course, we're talking about kids younger than 12.
Many school districts and county health departments implementing mask mandates for those grades. And it's a move that parents have, for the most part, resisted. A few even sought out a mask exemption for their kids.
But the question is, what does it take to get one? From Rhode Island to Missouri, Florida, and even here in Grand Rapids, the question is the same. How do you get an exemption from mask mandates and vaccines? Doctors say not everyone should be asking for one in the first place.
By and large, we encourage everybody to mask up. We encourage everybody to get the vaccine.
Dr. Jeffrey Wu works internal medicine at faith-based Christian healthcare centers in Grand Rapids. He says when it comes to getting a medical exemption for wearing a mask or getting a shot, he's really not your guy. No doctor is.
We aren't the ones who actually exempt anybody. That is between the individual and the organization with whom they're trying to obtain an exemption.
Whether it's a school, an employer, or otherwise, exemptions aren't something that doctors can just give out. A letter of diagnosis confirming an ailment, that's about the best they can do.
But we ultimately defer to employers, to schools, to determine if those things qualify.
Dr. Wu says he's only written one letter of diagnosis for someone who is pregnant. The CDC guidelines are extremely strict, and neither doctors nor faith leaders can guarantee an exemption.
The church doesn't grant medical exemptions.
Bishop Gerald Battersby says his pastors have had people approaching them about religious exemptions, but
one of the things that the church doesn't want to get involved in is those who are seeking it and trying to conflate a political objective with a religious objective.
And even those that do receive a pass from shots and masking,
they'll have to take other measures which will ensure the safety of their neighbor.
For schools, especially Kent ISD, the intersection between specialized learning and safety is something they've thought about a lot. Students who are paralyzed, on the autism spectrum, have sensory overload issues, or other impairments do often have grounds for mask exemptions.
We want those kids to be here, happy, safe, and learning. So we work with families, and we haven't had a problem.
Trish Lepucky runs the Deaf and Hard of Hearing program at Kent ISD. She said even despite the challenges of learning without sound,
which isn't just on the hands, it's also on the face,
most of their 80 students in the program are still wearing masks, reading lips through clear ones, or using American Sign Language to learn. For those who can't wear a mask because of a cognitive or physical impairment, Kent ISD has other safety options, says Program Director Paul Domowski.
From screenings before they enter the door, to social distancing, to cleaning procedures. It's that layered approach that has kept our kids safe, but also has kept them engaged in learning.
Schools, faith leaders, and doctors now all walking together that fine line between freedom and safety.
While we want to promote patient autonomy, we want to promote individual liberty, we also need to do our job and encourage them to do the best they can. And I wouldn't be doing my job, I wouldn't be doing what they pay me to do if I weren't telling them what the evidence and what medical science advocates for, which is that they do the best they can to protect themselves.
Yeah, and there are some restrictions. To see who qualifies for a potential exemption, the CDC lists their criteria on their website, cdc.gov, or you can find that on our website, fox17online.com. We're going to have more on the coronavirus surge in the U.S. and how it's impacting hospitals a little bit later on in this hour.